What's up, beautiful people? Another day, another study. I've talked before on the channel about cognitive resilience. It's a theory that some people with the same neuropathology, meaning you look at imaging or labs or something like that, and they have dementia signals, and these people with cognitive resilience have better functioning, better performance than other people who have similar neuropathology. And we know several factors like physical activity and education that can impart cognitive resilience, but this was a meta-analysis, so a study of studies looking at digital technology and does that impart cognitive resilience. And some people are concerned that technology use can worsen cognitive health. Others say it can improve cognitive health through things like social connection, complex mental activities, and then digital compensation or digital scaffolding, which is as cognitive function declines, technology can help improve performance, and then that can delay progression to mild cognitive impairment or dementia. But in this meta analysis, they included 57 studies with over 400,000 participants, and they found that greater everyday use of digital technology. So this is natural use. This is not using it more than normal. It's just what do people do in their everyday. So greater use of everyday digital technology was associated with a 58% lower risk of cognitive decline. And that was measured by cognitive testing or diagnosis of mild clinical impairment or dementia diagnosis. In the longitudinal studies with an average duration of 6.2 years, there's a 26% reduction in cognitive decline. So both the longitudinal and the cross-sectional studies showed a reduced risk of development of cognitive decline through everyday use of technology. And as alluded to earlier, mechanisms for this possibly include dynamic cognitive stimulation. So using the digital technology, like things change, interfaces change, new games, so forth. So it's a dynamic environment, facilitating social connection. And then, as I mentioned earlier, that digital scaffolding. So I love to see research like this looking at comprehensive ways for us to improve our cognitive health.